Concerta is a central nervous system stimulant. Each extended-release tablet for once-a-day oral administration contains 18, 27, 36, or 54 milligrams of methylphenidate and is designed to have a 12-hour duration of effect. Concerta Red is a prescription drug. What is Concerta and what is it used for? This medication is used to treat attention deficit hyperactivity disorder. It works by changing the amounts of certain natural substances in the brain. Methylphenidate belongs to a class of drugs known as stimulants. It can help increase your ability to pay attention, stay focused on an activity, and control behavior problems. It may also help you to organize your tasks and improve listening skills. Things to know before using Concerta. Before taking methylphenidate, tell your doctor or pharmacist if you are allergic to it, or to dexmethylphenidate, or if you have any other allergies. This product may contain inactive ingredients, which can cause allergic reactions or other problems. You should use caution taking Concerta if you have a history of heart or mental problems, untreated glaucoma, tics or history of Tourette's syndrome, circulation problems, esophagus, stomach or intestine problems. Report to your doctor any heart-related problems or a family history of heart and blood pressure problems. Stimulants can increase blood pressure and heart rate. Physicians should monitor these vital signs closely during treatment. Call your doctor immediately if you or your child experiences warning signs such as chest pain, shortness of breath, or fainting while taking Concerta. Disclose to your physician all mental health issues including any family history of suicide, bipolar illness, tics, or depression. Patients should be evaluated for bipolar disorder, tics, and Tourette's syndrome prior to stimulant administration. Concerta may create new or exacerbate existing behavior problems, bipolar illness, or Tourette's syndrome. Call your doctor immediately if you or your child experiences new or worsening mental health symptoms including hallucinations or sudden suspicions. Discuss circulation problems with your doctor before taking Concerta, which has been known to cause numbness, coolness, or pain in fingers or toes, including Raynaud's phenomenon. Report to your doctor any new blood flow problems, pain, skin color changes, or sensitivities to temperature while taking Concerta. Stimulants like Concerta have a potential for abuse, especially among people who do not have attention deficit hyperactivity disorder. People with a history of drug abuse should use caution when trying this medication. Taking the medication exactly as prescribed can reduce potential for abuse. If you're thinking of becoming pregnant, discuss the use of Concerta with your doctor. The FDA designates miles per hour as a pregnancy risk category C, which means that no risk of birth defects, difficulty with the pregnancy, or problems with delivery or the postpartum period have been found. But these problems cannot be absolutely ruled out either. Concerta is passed through breast milk. Before taking Concerta, discuss all other active prescription medications with your doctor. Concerta can have a dangerous, possibly fatal, interaction with antidepressants including MAOIs. Tell your doctor if you are taking blood thinners, blood pressure medication, or any medication containing a decongestant. How is Concerta used? Take this medication by mouth with or without food as directed by your doctor, usually once daily in the morning. Taking this medication late in the day may cause trouble sleeping. Swallow this medication with a full glass of liquid. Do not crush or chew this medication. Doing so can release all of the drug at once, increasing the risk of side effects. Swallow the whole or split tablet without crushing or chewing. The optimal dosage of Concerta varies by patient. Concerta capsules are available in 18 mg, 27 mg, 36 mg, and 54 mg dosages. The time-release formulation is designed to maintain an ever-increasing blood level of medication in your body throughout the day. The guidance suggests a maximum 54 mg daily dose for children and adolescents, and 72 mg daily for adults. As with all medications, follow your Concerta prescription instructions exactly. Concerta is taken orally, with or without food, once daily, typically taken first thing in the morning. It should be taken at the same time each day for the best results. The dosage is based on your medical condition and response to treatment. Your doctor may direct you to gradually increase or decrease your dose. Also, if you have used it for a long time, do not suddenly stop using this drug without consulting your doctor. If you suddenly stop using this medication, you may have withdrawal symptoms. To help prevent withdrawal, your doctor may lower your dose slowly. Withdrawal is more likely if you have used methylphenidate for a long time or in high doses. Tell your doctor or pharmacist right away if you have withdrawal. Though it helps many people, this medication may sometimes cause addiction. This risk may be higher if you have a substance use disorder. Side effects that may occur with the use of Concerta include decreased appetite, dry mouth, sleeping disorder, dizziness, abdominal pain, increased sweating, headache, nausea, weight loss, irritability are common side effects. If this video was useful for you, please like the video and subscribe to the channel. I wish you healthy days.